Thank you. And as you guys can see, we're really fortunate at 100 Grow Women to have these amazing young women helping us build our organization, drive our organization, and bring their perspectives. And when I first met with the presenters, and I mentioned at one of our weekly staff meetings about this topic, I was just overwhelmed by what I heard from our students about what a huge issue it is on campuses and in their lives. So I'm really excited to learn more today. And I'm going to turn it over to myself, I guess, to just do a couple brief introductions about our presenters today. So Erin Simmons is from Mankato, Minnesota. And of course, I have a special place in my heart from Mankato, sort of my hometown. So welcome, Erin. And Erin is the executive director of My Youth Place, which is my place in Mankato. And Liz Johnson is from Duluth, and Liz is currently working with the American Lung Association as part of the Minnesotans for Smoke-Free Generation. So I just wanted to do a brief intro because I really want Erin and Liz to tell you more about themselves because they both have amazing backgrounds. So whoever wants to go first, Liz, Erin, who'd like to go first to introduce yourself, and then I'm turning it over to you to go forward.
Okay. All right. Well, hello, everyone. I'm Erin, and I am, as Teresa said, based here in Mankato. I'm the executive director of Mankato Youth Place. And prior to being here, I spent about 15 years working with the American Lung Association on various tobacco policies, going back to the early 2000s when we worked on smoke-free indoor air, which is probably unimaginable for some of you who are younger and don't recall a time when you went into a restaurant or a bowling alley and there was smoking happening in the booth next to you. So I've been around tobacco policy for a while, and now am working with what would be considered at-risk youth. And so I'm seeing how it plays out in the community. I also have 4 kids. My kids range in age from 15 to 20. And so see it there as well.
Okay, and hi everybody, I'm Liz and I live in Duluth, Minnesota. I am currently working with the American Lung Association, and I've worked with them in the past, and then am back working with them specifically to address this issue of epidemic of teen vaping. And prior to this, I have spent most of my adult life working to train women to run for office and win. And I've been characterized as a dog on a bone when it comes to rural women's leadership. And as part of that passion, I worked to build a program called Plate to Politics, where we did a lot of work with women in rural communities in the sustainable ag field, and doing leadership skills that then translate to joining your county commission, going to the state legislature. And I'm a founder and co-founder and board member for an organization called Vote, Run, Lead, which is a national organization, but it was born right here in my living room in Duluth. And check them out when you get a chance. I see Beth Peterson's on here from Vote, Run, Lead. Yay! And that's enough about me for now.
Well, great. And Liz, why don't we jump right into presentation? So if you want to,
I'm going to share my
start
screen.
that out.
So Erin and I talked. Okay, so there is a ton of information on flavored e-cigarettes, and we could spend a whole semester working on these issues. And I'm really, by the way, I'm psyched to see Helen, who I recently met through my work with the Lung Association, and that Taylor Blakeman they're both also on former Lung Association employee, and they can also add to this conversation. But I'm gonna sort of throw down a bunch of facts and on each slide, and then Erin's gonna kind of take it to the real world scenario. And then I want to get to the conversation as soon as possible. So and we'll do questions after that. So just basically, I want to, talk about what is it, because it's really unbelievable, the variety of flavors and that products that are available that are really kind of targeted towards getting young people, kids and young people to start using tobacco. You can see these tobacco products and they're like grape, cotton candy, Skittles, Sour Patch Kids. You've probably seen there's a lot of media actually happening on vaping if you're watching any of the broadcast channels lately, because the state of Minnesota has taken one of these companies, Juul, to court, and the trial started today. And they're basically suing this company for the damages. Really, prior to this vaping device coming, it's at the bottom left product, I think, is the Juul. What a Juul looks like. If you haven't seen somebody using it, it looks like a jump drive for your computer. But the tobacco control community, American Lung, Minnesota Department of Health, Cancer Society, there's 54 groups in this coalition called the Minnesotans for a Smoke-Free Generation. They had taken that big tobacco trial money from years ago and done really amazing work and had gotten youth smoking down to 3%. And now it's back up to like 17, 20, and even more depending on which study you're looking at. But it really did really take off, and it has tapered recently because Juul was taken off the market because it was just so pernicious and pervasive. And so it's these little cheap cigars that cost like 99 cents that you get your, tobacco 21 was also passed. So that helps reduce the number of youth that are getting it from their 18-year-old friend. But they're out and about, and they mask the harshness of the tobacco. And in the case of menthol, it actually soothes your throat and makes it just easier to start. And the menthol in particular is very pernicious because it makes it easier to start and harder to quit. And I'll talk a little bit more about menthol later. But 70% of youth e-cigarette users in Minnesota are now showing signs of nicotine dependence. And 1 in 7 or 14% of 11th grade students and 7% of 8th grade students report currently using e-cigarettes. And it's 3 times the number of the adult rate, 14%. The adult use rate is 5%. And so that's just sort of just a broad view of what they are. Erin?
Thanks, Liz. That's a great image on the screen here, because I think when you all take a look at these products, you can see one of the concerns being they look friendly, they look like candy, they're bright and eye-catching. And if you look at the vape pens and vape devices, they also look a little confusing. For those of us who are in our middle years or higher, we might look at those devices and think, I don't even know what that is. I wouldn't even recognize it. And frankly, therein lies the problem. We have youth who are really drawn to these products. They taste good. They don't have the harsh smell of a cigarette. And they're easy for kids to get their hands on. You know, Tobacco 21 being passed was impactful, but we're not there yet. As a mom and as executive director of a youth organization, I can easily see the impact that some of these products are having on our kids, especially vaping. I think one of the really critical steps for all of us as grown-up adults in the community is to know what these products are, to know what they look like, because if we don't even recognize them when we see them, we can't do a whole lot about them. If as a parent, I don't know what these devices look like and they're sitting on my kid's desk or dresser, I won't even recognize it when I see it. I'll walk right by it, and I'm not going to have really hard and important conversations with my kids. This morning, I was thinking a little bit about this time today, and it occurred to me that there might be a gap generation. Those of us who grew up in the 80s and 90s, we were taught all of the dangers of smoking, and we saw smoking rates go down and down and down, like Liz mentioned. And so our age group might be not very heavily impacted by smoking related diseases, whereas my parents' generation, they grew up in the Marlboro Man years and high levels of smoking cigarettes. My children's generation are growing up in the vaping years. And I think we could experience this gap and bubble in the middle where we have low use rates and are going to see healthy lungs for more years. But it's I think possibly going to be heartbreaking for us to watch our kids' generation as well. One important point of perspective that I want to share with all of you, here at my place or Mankato Youth Place, we serve kids who have a lot of risk factors. They're experiencing poverty. The majority of the kids we serve here are kids of color. And things at home might be tough for some of our kids, and they might have higher exposure to things like drugs and alcohol. We have a fourth grader here at my place who has been found to use vape twice in the last couple of months. Fourth grade. We're talking about 9 and 10-year-olds in the fourth grade. We're talking about elementary school, not yet on their way to middle school. Not only do those kiddos know what it is, but their peers are using it in the bathroom and on the bus. And so this becomes a really critical conversation because a fourth grader isn't at an age yet where they're able to really see this clearly. And I don't know that many adults in the community are talking to fourth graders about vaping. I don't know how many parents are talking with their elementary school kids about vaping. And while the kiddo that I'm talking about has some risk factors at home, that doesn't mean that everybody else in her class does, or everybody else on the bus or in the bathroom with her does. And they now have access because she has access. And that's the way it gets rolled out in the community.
Okay, thanks, Erin. Okay, so the impact is pretty significant. Nicotine is really bad for the young brain. It's just, there's just no amount of nicotine that's safe while your brain is developing. And it's a highly addictive central nervous system stimulant. It's not it's interesting because some of the young folks are turning to these products to relieve their anxiety because they think it's going to relax them. But really what it is, it's getting you on that stimulant, gets you back on that roller coaster of the ups and downs. It increases using the vape products and also increases your risk of smoking conventional cigarettes. That's sort of what the adult data is also showing, that folks they get told that it might be a cessation device, which it is clearly not. It's designed to help people get off nicotine. But often the vape user, young or old, will end up going back or turning to regular tobacco cigarettes, conventional combustible cigarettes, and because they need to get more nicotine faster. And so youth exposed to nicotine are also more likely to start using other substances. And it's just really, I don't know how many of you have ever been addicted to nicotine, or know somebody who has. I think it's pretty well known that it's one of the hardest things you could possibly do. You know, it's so hard to quit. And so it's just shameful that this product that actually delivers much higher levels of nicotine in cotton candy and Skittle flavors is, you know, just available to young people. They're really, once you try it, if you Google, you know, some of the parents that have started organizing about vaping and stuff, and hear their stories about what happens to a young person once they get addicted and need to have their vape devices. It's pretty moving, the stories, and really quite sad. Erin, do you have anything to add to this slide?
I do. One of the things I found most stunning when I started doing tobacco control work was that nicotine is more addictive than most any other substance. It's more addictive than heroin and cocaine, but you can use it openly out on the street, which means the triggers are there as well. One of the unique things about vaping in comparison to smoking a cigarette is that for a lot of folks, they have access all day. So what that looks like at the user's level, a cigarette smoker probably has to go outside. They smoke a cigarette, maybe 2 cigarettes, and so their nicotine level goes real high in a short period of time. And then it slowly starts progressing down until generally the user can't stand it anymore. And then they go back and have another. And with somebody who's using vape, their nicotine level is pretty constant all day long. And then what happens is their tolerance bounces up to that level. And so now they need more. So now they're going to take a couple of puffs and they're going to take it more frequently. And that's just going to grow and grow. So where a cigarette user has peaks and valleys in their nicotine use, that can be beneficial when it's time to quit because they are already used to some of those feelings. Someone who's vaping doesn't have those peaks and valleys. They're just at a constant flow of nicotine all day. And so their addiction level can be much higher, making it harder to quit, excuse me. The other thing that I wanted to mention, Liz, is that what I'm hearing from folks who are working on the drug task force here in Mankato is that fentanyl is being found in marijuana. And that's certainly applicable to a smoked marijuana, but it's also applicable to vape. And so if our young people are vaping marijuana that they're buying on the streets, that right now in Mankato, they're finding that vape with fentanyl in it. And I'll tell you what, as somebody who works with kids and somebody who has young adults, that stopped me in my tracks because I think our youth perceive vape and marijuana use to be very safe and not super risky behaviors. And now we're throwing fentanyl in the mix, and that's really concerning to me.
Yeah, I mean, it's quite astounding, really, what young people are up against, because this is really so heavily marketed. So just quickly to talk about from the rural angle, a new decades-long study was released last September that shows that in rural communities, tobacco use is 33% higher, and the success rate for quitting is 75% lower. So it really is, you know, I would add it to another, you know, health disparities group, you know, because the evidence is so clear that these products cause disease, death, and Minnesota's #1 cause of death and disease is from tobacco products. And so if your community is using it more, then that's really the result. Erin?
When I was doing tobacco control, we talked a lot about the density of tobacco retailers and tobacco marketing being much higher in low-income neighborhoods. I myself live out in the country, and so that didn't mean a whole lot to me personally. But now I work in our downtown area, which is a generally pretty low-income area. We've got 2 fraternity houses across the street from us. And one of the first things that I noticed when I started working in this building is that 1 block down the street from me, we have 2 Pepsi machines that are pushed right up to the sidewalk. And it was one of those moments where I thought, this is it. Because in our middle and upper class neighborhoods in Mankato, you're not going to find a Pepsi machine on the sidewalk. and I think it's really indicative as to what's happening in our low-income neighborhoods. When I look down the downtown corridor here, I can identify a significant number of tobacco retailers, whether it's a convenience store, liquor store, or a tobacco shop. We have a new tobacco retailer coming into our Old Town neighborhood. Its name is High Tech Clouds. And we'll just leave it at that. But a friend who owns a business in that neighborhood asked the retailer who marketed that space kind of how that came to be. How is this particular business a fit for our downtown Old Town neighborhood? And they were told that there was a gap in the market in that neighborhood. There wasn't a vape shop in that neighborhood yet, and so that's how they got to be there. I also think always about our West High School, which is located at a 4-way stop. And West is on one corner of that intersection. And the other 3 intersections all have a tobacco retailer. There's a grocery store where the liquor store side is directly across the street from the high school with their liquor signs on the boulevard. There's a tobacco shop that is known to participate in all kinds of activity. And there's a convenience store. And then I look to our brand new middle school, Prairie Winds, and I see tobacco retailers popping up at their intersections as well. And I think it's just super important to note that that's not a coincidence. It's not a coincidence that stores that are marketing these products are popping up next to places that our youth are spending their time.
Okay, so I said I'd get back to menthol products. This in and of itself is just a huge area of work, and there's a menthol coalition within the tobacco control movement here in Minnesota that really focuses on how the tobacco industry has used, menthol cigarettes to target especially the Black community, the American Indigenous community, and the LGBTQ community. And it is that cooling sensation that masks tobacco's harshness, makes it easier to quit, or easier to start, harder to quit. And one of the stories I learned when I first started doing this work was, when they don't have, when you think of Marlboro's traditional commercial tobacco products that you light a match and burn, we don't have cherry flavored Marlboros. We don't have cotton candy Marlboros. They made that illegal. And when they made that illegal on the federal level, there was a deal made behind closed doors that menthol didn't really matter. And menthol is also the choice of 85% of Black smokers. Like, so this is just really, this is like the quintessential health policy, health disparity resulting in, like, death and disease. And it's not some of, if you go, some of the events that we've done, they go back into like the advertising history, like the very first time African Americans were even featured in mainstream advertising was for Cool brand cigarettes and all the menthol products like that is. And then you just need to open your eyes when you're traveling in Black communities. You'll see the amount of advertising that the tobacco industry does there. It's really shameful. And but I also have to say that it's 42% of the American Indigenous community and 36% of LGBTQ, and the white community opts to use menthol at less than 30%. But it's just another reason why we just absolutely can make change. We've, that these tobacco control policies have major implications, and every step we take, towards like this drumbeat of getting rid of these deadly products, it will save people's lives, and which makes the work really important. Erin, did you have anything to add?
I do not, thank you.
Okay. And then just this is a new area, a newer area, but I had to just show this ad. Like, I think this is just such it's like, oh, I could sleep better, I could eat healthy, I could be happy and active with these fortified electronic Nutri-Cigs. Come on, it's toxic poison that you're putting into your lungs. And I just think it's such a mind, messing with young minds to put these things out there as if they're healthier or better for you in some way and will help you, sleep better and be thin. It's really crazy. So the data is now showing that 81% of young people who have used e-cigarettes say they started vaping to decrease stress, anxiety, or depression. More than half of vapers use e-cigarettes to cope. Those who vaped 20 or more days in the past month reported that they needed to vape to cope with stress or anxiety. I have seen this firsthand in people I know, and it's heartbreaking because they're very young, and nicotine will worsen anxiety and amplify your depression. It doesn't make it better, it makes it worse. So that to me, and again, there are folks that are just organizing like in this mental health space to, there are a lot of people who want these products to go away. So there's that. And then just quickly, we spend $3 billion a year in Minnesota in excess healthcare costs. That's $554 per human. That's like every person in your family, no matter their age, every person in your community, no matter, like, per capita in Minnesota annually is what it costs us. And that's not even considering the $4 billion in lost productivity because people are sick and dying from tobacco disease. So it's really I don't hold out a lot of hope for the, well, we'll see what happens with this next trial. I think I'll leave it at that. And then Erin, do you wanna just share what this photo is, and then we'll get to questions?
Yeah, so these are some of our youth who were doing distance learning with us. And that was, of course, a really difficult time for kids in our community, especially teens, and especially teens who had already found themselves to be sometimes, in some cases, several years behind their peers academically. And so we partnered with the American Lung Association during that time to do advocacy training, which was really exciting for me to bring my two worlds together, but to see a group of kids who aren't generally asked what they want. They aren't generally asked what their opinions on policy and politics are. And they're definitely not engaged in those conversations in our community to be able to participate. And so they were doing in this picture Day at the Capitol remotely, but they were in this picture meeting with some of our area legislators. They got 2 quick yeses in support of the policy, tobacco policy they were advocating for, but they reached probably not. And through their advocacy, that elected official changed their mind and became a yes in support of the policy. So I think it kind of speaks to the importance of all of us being engaged. We as adults need to know what these products are. If you don't know what they are, and if you don't recognize vape and vape pens and e-juice, go into a vape shop. It's going to feel uncomfortable. They're going to wonder why you're there. Don't buy anything. Don't try it. Don't take a sample, but go in and look around and see what our kids are up against. Once you've learned more, then you can do more, and you can do more to engage kids in the community in the conversation, and your peers in the community in the conversation.
Okay, so